Greetings and welcome to this learning session. This session will include a general overview of autism, along with strategies that can be considered for use in the home and the community. As we begin, I would like to share these statements with you to ponder when learning about a person with autism. Know that by simply meeting one person with autism is not a one-size-fits-all when it comes to what autism looks like. Keep in mind that one autistic person may be quiet and have supports for communication, while another autistic person may be chatty with heightened sensory needs. Every autistic person experiences their own variation of the spectrum, paired with a wide range of characteristics, abilities, and support needs. Keep in mind that autism is a spectrum disorder. Therefore, each person with autism is going to have different related symptoms. What is one of the first things we think about when we hear the word spectrum? Maybe a rainbow with every color and gradient in between. All individuals with autism may not experience all the same characteristics. Symptoms can look different from one individual to another, including the amount of support to be successful in the school, home, or the community. The infinity image at the bottom of this slide is a newly adopted symbol. It represents the autism community and neurodiversity with infinite variations within the autism spectrum, as well as the never-ending growth and ability of the neurodiverse community. Upon completion of this learning opportunity, participants will be able to define autism and its related characteristics, summarize some generalized strategies, and initiate a generalized strategy for use in your home and/or community. Throughout today's session, I will use multiple terms related to autism spectrum disorder. These will include autism, ASD, a person with autism, or an autistic person. These terms include both person-first and identity-first language as recently adopted. This is our agenda for today's session, which will include facts regarding autism or ASD, what autism might look like in your home and/or community, and some general strategies for supporting your child. Let's begin with a quiz to see what you already know. This will be a true-false format, and I will provide you with the correct answer as well as the rationale behind each answer. The first statement states that poor parenting causes autism. Take a moment and think if you believe this statement is true or false. I will reveal the answer on the next slide. The answer is false. Autism can sometimes lead to children displaying difficult behaviors. And although poor parenting does not cause autism, behaviors may be exacerbated or ameliorated by parenting style. The next statement states the incidence of autism has risen considerably since it was first identified as a disorder. Take a moment and think if you believe this statement is true or false. I will reveal the answer on the next slide. The answer is true. The incidence of autism has risen considerably, and I will share those statistics with you after this quiz. It is not known why this rise has occurred, although diagnostic criteria has broadened, leading to more children being identified. The next statement states that boys are diagnosed more than girls. Take a moment and think if you believe this statement is true or false. I will reveal the answer on the next slide. This statement is true. Autism is diagnosed 4 to 1 in boys to girls. The next statement states that people with autism will naturally grow out of it as they get older. Take a moment and think if you believe this statement is true or false. I will reveal the answer on the next slide. The answer is false. Children with ASD will continue to develop, but they will always have characteristics associated with the dyad of symptoms according to the DSM-5. There are many therapy and treatment options that can be considered. The next statement states that autism is a continuum ranging from mild to severe. Take a moment and think if you believe this statement is true or false. I will reveal the answer on the next slide. This statement is true. Autism is technically called a spectrum disorder since there are a wide range of characteristics or symptoms experienced by people with autism that can affect each individual differently in different situations. The next statement states that there is no known cause of autism. Take a moment and think if you believe this statement is true or false. I will reveal the answer on the next slide. This statement is true. There is no conclusive cause of autism. Continual research is being conducted to find the cause. The genetics are complicated, but autism does seem to occur more frequently in families where another family member has autism. The next statement states that autism can include symptoms in social skills, communication, and behavior. Take a moment and think if you believe this statement is true or false. I will reveal the answer on the next slide. This statement is true. The DSM-5 lists two main diagnostic criteria for the diagnosis of autism: social interaction and communication, and restricted repetitive behavior. This last statement states that people with autism can live productive lives in society with independence. Take a moment and think if you believe this statement is true or false. I will reveal the answer on the next slide. This statement is true. People with autism can live productive and successful lives through support, learning, and the maintenance of skills towards independence. You, as a parent or guardian of someone with autism, play an integral role in the independence of your child. The first agenda item I will cover is facts regarding ASD. Again, I will use the terms ASD, autism, and autism spectrum disorder interchangeably throughout this presentation. According to the Diagnostic and Statistical Manual of Mental Disorders, also called the DSM-5, Autism is a neurodevelopmental disorder that affects social communication and interaction, as well as the presence of restricted and repetitive behaviors or interests. It is usually diagnosed in early childhood, and its symptoms can vary in severity from one individual to another. Looking at this graphic on the slide, autism can be thought of as a dyad of symptoms. Individuals with autism may have challenges in social interactions, communication, and may exhibit sensory sensitivities as well as repetitive behaviors or intense interests in specific topics. Autism is a spectrum disorder, meaning there is a range of variability in the type and severity of symptoms individuals may experience and its impacts individuals across gender, ethnicity, and socioeconomic background. All individuals with autism may not experience all the characteristics associated with autism. Symptoms can look different from one individual to another, including the amount of support necessary to be successful in the school, home, or the community. Keep this in mind as I review some of the characteristics that you may see in a person with autism. Characteristics of the dyad of symptoms that the DSM-5 has identified include social communication and interaction and restricted repetitive behavior. Social communication and interaction may include deficits in social emotional reciprocity and non-vocal communicative behavior. For example, the individual may have a difficult time maintaining a conversation, or the conversation may tend to be one-sided. The individual may not understand non-vocal communication, such as body language or gestures, or they may have a difficult time picking up on tone or voice meaning. Possible deficits in social skills may include an individual's ability to develop and maintain relationships, understand friendships, or distinguish an inappropriate relationship. There may also be an inability to share enjoyment with others, maybe more focused on what is enjoyable to them, and they may not notice when someone is trying to gain their attention. Possible symptoms in restricted repetitive behavior may include stereotypic or repetitive motor movements such as jumping, hand flapping, or head twitching, or scripting or echoing the same statements repetitively. Their desire for routine and sameness, such as the schedule, the order of tasks, where they sit, rituals, or fixated interests may be evident and lead to problem behavior if these are changed. There may also be hyper or hypo sensitivity to sensory input observed, which may require headphones, sunglasses, or other sensory items. So how common is autism? The statistics of the prevalence of autism are displayed on this slide. As you can see, the rate of children diagnosed with ASD has significantly risen over the past 23 years. It is also important to note that the ratio of identified boys to girls is 4:1. Let's now discuss how ASD might look in your home and/or community. Take a moment to review this slide to recognize some of the symptoms you may see in your child. Some examples include difficulties with verbal instructions, poor reading comprehension, the preference for solo play, incongruent body language with the message, and the inability to take another's perspective or adjust their language based on the situation. You may notice deficits in your child in regard to restricted or repetitive patterns of behavior or interests. This may include repetitive, stereotypical motor movements or language, a preoccupation with parts of objects rather than the whole, a preference for only a few activities or topics, a difficulty with transitions, changes in routines, or unexpected events, or your child may engage in self-injurious behavior. Now that you have a better understanding of the symptoms related to ASD, I am going to discuss basic strategies that you may consider implementing into your homes and communities to best support your child. Within this topic of strategies, I will discuss specifics related to universal strategies, such as how to maintain organization, teach communication skills, filter sensory input, use visual supports, and implement some basic behavior management strategies. I will discuss universal strategies. I will use the next few slides to review each of these strategies. The first universal strategy is maintaining organization and teaching organization to your child. Teaching organization will help to promote independence. This slide displays multiple organizational methods, which can include bins containing a variety of items that can be color-coded and labeled, the use of planners, agendas, calendars to track upcoming activities or transitions, the use of whiteboards to create checklists, grocery lists, or menus for the week, and labeling clothes dressers to organize and select clothing. The second strategy is providing literal explanations to decrease misunderstandings with the gist of the message. Some individuals with autism tend to be concrete thinkers and may need literal directions or explanations. Be sure to use language that is clear and concrete. Clear and concrete language is specific and tangible. These are words that we experience through our five senses: touch, taste, see, etc., such as a fork, the color purple, etc. While abstract language uses intangible items or qualities. Abstract language may have different meanings for different individuals, which can make it difficult to understand, such as gentle, independent, or love. There are two examples on this slide. The first shows words from abstract to concrete, transportation to vehicle, using a vehicle as a means of transportation, car as a type of vehicle, to Billy's car, which identifies a specific car with tangible features. The second example is a sentence describing the time Mary had outside. An abstract sentence may read, Mary engaged in physical activity outside, while a more concrete statement would state exactly what she did. While on the playground, Mary kicked a soccer ball in the grass field. Creating intentional or structured, as well as incidental opportunities to practice social skills is key to learning and maintaining these skills to independence. Consider scheduling in a social skills instruction time daily to cover identified social skills topics that are pertinent for your child's growth. Determine what your child could work on. Examples may include greeting others, maintaining a conversation, asking for help, or learning how to wait. Also consider providing monitoring and support of social skills within social settings, such as during leisure activities, at the playground, while playing games, and during peer or sibling activities and interactions. Examples of structured social skills learning opportunities may occur during mealtimes, when siblings or other family members arrive or depart, specifically reading a social story or watching a social video related to the upcoming activity just prior to the activity, or engaging in a role play about the upcoming scenario. Examples of unstructured or incidental social skills learning opportunities may occur more spontaneously when someone visits unexpectedly, during an impromptu outing, or walking past a neighbor on the street. Consider teaching your child how to appropriately de-escalate and maintain calmness, as well as possibly handle conflict with others. Consider teaching your child how to take a break. This slide displays a break card along with emotion pictures to assist your child in understanding how they feel and that they can take a break if needed. The image on the right is an example of an item in your child's room, such as a beanbag, which can assist with de-escalation and calmness. Transition tools and timers are great ways to provide information to your child of upcoming changes and transitions, and can also be used to let your child know when they can earn a highly preferred item or activity, or how long they have to wait. This slide displays several different examples of transition tools and timers that you can use with your child. The example on the top left is a simple phone timer, which will include a visual as well as an auditory cue when the time is up. The example on the bottom left is a curtain timer, in which as the timer nears its end, the red curtain gets less and less noticeable. The example on the top right is both an auditory as well as a visual timer, in which we'll count down from green, yellow to red when the time is up. The visual on the bottom right is a visual support for a timer, in which you would take off the pieces from 1 to 2 to 3 until it's time to stop. The next section of related strategies is regarding communication. I will highlight the importance of communication with and for your child, as well as the systems available for their communication. Communication is important in teaching individuals to express themselves, their opinions and ideas, as well as wants and needs. It is also important in understanding what others are saying or understanding events and activities, also known as receptive communication. Communication skills are needed to facilitate learning and engage in meaningful exchanges with others. Functional communication, being able to effectively communicate for a purpose or meaning, is necessary in order to get your needs or wants met in an appropriate way. Without functional communication, undesired behaviors may be learned as a means to communicate. Direct instruction and reinforcement on communication strategies are needed in order to acquire, maintain, and generalize communication skills. Some areas may include asking for items or people, asking for help, requesting a break, asking important questions in order to complete an activity or task, asking questions and commenting on a topic, and learning how to appropriately interrupt. This creates purposeful or meaningful communication. Individuals communicate in a variety of ways. This slide shows examples of the ways that people can communicate. It is important to determine the communication systems for your child so that they are effective, functional, and purposeful. Keep in mind, your child will not always be with you for interpretation, so it is important to ensure that they have a universal communication system that can be understood by all. Be sure to discuss all communication options with your child's IEP team. Next, I will discuss how you can filter sensory input for your child. At times, colors, sounds, and other environmental components can be distracting or overstimulating, and at times negatively impact your child. In a sensory-friendly environment, lighting and colors are calm, visual displays are minimal, and noise is controlled. I will share a few examples of how to minimize sensory input for you to consider with your child over the next few slides. This slide shows a few views of a variety of bedroom setups to help filter sensory input. There is minimal items in the room and on the walls. The colors are neutral, and there are lamps being used to filter extra light. There is a beanbag available for de-escalation. Certain sensory input through the eyes, ears, touch, smell, taste, etc. can be overwhelming and distracting for some. Filtering sensory input may be important in order to support the calmness of your child. Consider these adaptations to their bedroom and other areas in the home. Look at minimizing items on the walls, decreasing the use of fluorescent lighting, decreasing loud noises through the use of area rugs and closing doors, maintaining some level of light in the bedroom and home, and being aware of environmental variables that may affect your child, such as clothing textures, fabrics and fit, smells, temperatures, and certain foods. You may also need to be aware of sensory input when you are in the community. Behavior may change if your child experiences some of these qualities of high sensory input. It is important to recognize them and assist your child in decreasing its negative effect on them. Certain examples of items that may benefit your child may be noise-canceling headphones, sunglasses, or the knowledge of exit areas when you are in the community. It is critical to be aware and honor your child's specific sensory preferences to make them more comfortable. The next strategy I will discuss is one that has been heavily research-based and is called visual supports. Visual supports are concrete cues that provide information. The use of visual supports is a research or evidence-based practice for people with ASD. Visual supports can be used in a variety of ways. They can be used to establish expectations around activities, routines, or behaviors, provide cues or reminders, or provide preparation or instruction of an upcoming activity or event. The next few slides, I will provide you with a variety of examples of visual supports that may be considered for use in the home and community to support your child. The visuals on this slide establish expectations around activities, routines, or behaviors with a display of the morning and bedtime routine, provide cues or reminders when applying deodorant, and steps in the bedtime routine to provide preparation or instruction. The timer on the right can also be considered a visual support that may be used to give a visual of when an activity will begin or end. Visual supports can be used to assist you with teaching social skills to your child. This slide gives examples of visuals that can be used to teach your child how to initiate an interaction with another person, how to start a conversation, and how to request wants and needs. All of these visuals can be mobile for use also in the community. I will now discuss behavior strategies of reinforcement and praise that can be used with your child. Positive reinforcement occurs when a statement, item, action, or activity is presented immediately following a behavior that makes it then more likely that that particular behavior will occur again in the future. The item, statement, action, or activity that is added after the behavior occurs is called a reinforcer. For example, descriptive social praise or these statements presented by you to your child could occur when they follow a direction you provide, such as clean up toys, and then you would state, "Nice job cleaning up toys," after they clean them up. This would then make it more likely that the behavior of cleaning up toys would occur again in the future. There are many benefits to using positive reinforcement. These may include giving, not taking anything away, no negative consequence added, more powerful than punishment, it is easier to encourage than to discourage, more effective in the long term, positive incorporated with behaviors, as well as effective in teaching a new skill or a replacement behavior for an undesired behavior or skill. We are all motivated by different things, and so are our children. Therefore, it is important to ensure that reinforcers are individualized for each person. When determining reinforcers, ensure the items, activities, tangibles, etc. that are chosen are highly reinforcing for the person so that when they are used, they will likely work to increase the desired behavior. Be sure to create activities that incorporate your child's interests. Reinforcement should be person-driven to ensure they are motivated. You will have more buy-in from your child if you incorporate their interests and motivations. There are a variety of reinforcer types, from social to edible, as seen in this chart. This chart displays the different reinforcers that can be used as reinforcement. Reinforcer options should also be age appropriate. This slide showcases quick ways that families can use reinforcement with their children. These may include giving attention and praise when your child is being good, praising your child for successful steps, even if it's a small one, providing attention to your child without them having to earn it, celebrating your child's efforts, not just the results, praising your child with positive statements, offering your child genuine and realistic praise, displaying their work in a place of honor, writing positive notes or pictures for your child, praising your child consistently and often, and telling another adult or one of their siblings how proud you are of them while your child is listening. This slide is focusing on a few examples of reinforcement systems that you may consider using with your child. The top examples are called a first-then system. This type of system lists the activity or demand that you want your child to engage in first, as displayed through words or pictures under the word first, and then under the word then, what your child can earn after completing or engaging in the activity or demand. The then is a reinforcer, which is something that would motivate your child to complete or engage in the activity or demand. The image on the top left shows that the child is first expected to eat dinner and then can earn a cookie. The image on the top right shows that the child must go to the doctor's appointment. With the child can earn time at the playground. The image on the bottom is a star chart or token economy. In this example, your child would earn stars, check marks, smiley faces, or another visual representation of your child's choosing to then be placed in the boxes each time your child uses the bathroom. When the boxes are filled, your child would earn the reinforcing item that they selected, which would be in the box to the right of the equal signs. Now that I have presented you with some generalized strategies, let's conclude with a reflection for possible implementation in your home. Think about all of the strategies I discussed today. Which one would you like to begin with to better support your child, either at home or in the community? Do you want to assist your child with becoming more organized to promote their independence? Have an effective and functional communication system? Help them filter out sensory input that may be too overwhelming or stimulating. Start using visual supports for them to learn new skills, behaviors, or establish routines towards independence. Or help them learn difficult tasks or demands through the use of a reinforcement system, such as a first-then system or a token economy. Once you decide where you want to begin, take the first step towards better supporting your child. Thank you for taking time today to join me in today's learning session. Please contact Autism Resources at autism.resources@doe.k12.de.us if you have any questions related to today's presentation or would like additional information or support in implementing any of these strategies in your home.